Hello everyone, this is Shinamol Nair, Rowan University, class of Epidemiology, Health Promotion and Disease Prevention. Today I would like to talk about stress test to assess cardiovascular risk. As we all know that stress test is a very old traditional test to assess the cardiovascular functions. Even though there are major advancements in this field, stress test has its own diagnostic value to assess cardiovascular diseases. So now let's see what is a stress test. According to American Heart Association, stress test, which can be called as treadmill test or exercise test, is to find out how much stress the heart can handle. This test will discover if there is insufficient blood supply to the heart when the heart is required to pump more to meet the needs of oxygen and nutrients. Basically, what we do here is put the heart under stress by doing exercise and assess the cardiac function throughout the procedure. Let's see what are the indications of stress test. The first and foremost absolute indication for doing a stress test is to detect coronary artery disease. Second one, to evaluate chest pain, breathing problems, or lightheadedness related to cardiac conditions. So, when patients come with the symptoms like this, when we rule out pneumonia, emphysema, pneumothorax, anything like that, then we can move on to do a stress test to assess the function of the heart. Then to assess safe level of exercise. When the physician wants to assess how safely the patient can do exercise after major cardiac events or surgeries or any other procedures, it is stress test is a very good test to assess the safe level of exercise the patient can perform. Fourth one is to evaluate the treatment performed for CAD. So, as I mentioned, when patients undergo major cardiac events, when they undergo coronary artery bypass graft or interventional coronary catheterization, stent placement, angioplasty, anything like that, stress test follow-up stress test can be done to evaluate the treatment. Next one is to assess the probability of serious conditions like heart attack. When patients have family history of heart attack and when they have history of diabetes, hypertension, or high cholesterol, these things will put under them for risk for having major cardiac events. So when they have history of these conditions, it is advisable to perform a stress test to assess the probability of having this condition and take precautions accordingly. High blood pressure. Long-term history of high blood pressure is a stress to the heart, and it is advisable to do a stress test after a certain age when the patient has history of high blood pressure. Second, next one is valve problems. So when patients have asymptomatic valvular diseases like a mitral stenosis or aortic stenosis, further investigations can be done by doing a stress test. And next one is rhythm abnormalities. Rhythm abnormalities are also the patient should be stable when they have conditions like atrial fibrillation or ventricular arrhythmias. We can do a stress test to detect ischemia. As we mentioned, all the indications for the stress test, there are some contraindications also for doing a stress test. The first two are myocardial infarction and unstable angina. In these cases, the heart is already undergoing ischemia, so we cannot put the heart under stress to exacerbate that condition. So we should avoid doing a stress test. Then active endocarditis, then severe symptomatic aortic stenosis. So in this case, the heart is already working hard to pump the blood through a narrow valve. So in that case, we should avoid doing stress test. Decompensated heart failure. So in decompensated heart failure, heart is failing and it is unable to meet the demands of the body. So we cannot put the heart under stress in that conditions to do the stress test. Acute pulmonary embolism or DVT. Then next one is acute myocarditis or pericarditis. As in acute endocarditis, the myocarditis and pericarditis should be in conditions like these. In these conditions also we should avoid doing a stress test because heart is already under stress fighting the infection and fighting the demands of the body. We cannot put the heart under stress again. Acute aortic dissection. That is a very dangerous situation, so we cannot take the patient for stress test in this case. Then physical disability that inhibits safe and adequate testing. So in stress test, the patient need to do a little walking and a little running. So if the patient is unable to perform all these activities, the test won't be accurate. So a physical ability of the patient should be assessed prior to the test. Now let's see what are the monitoring parameters that we do during stress test. First one is heart rate. So heart rate will be monitored throughout the procedure, and there is a target heart rate need to be achieved during the procedure in order to have a diagnostic value. So if the patient is unable to reach that heart rate, the test result won't be that. Test result won't have that much diagnostic value in detecting ischemia. Then respiratory rate. So it should be assessed throughout the procedure in order to assess the condition, ability of the patient to complete the procedure. And if they are having breathing difficulty and they are unable to do the procedure, we should stop it. And blood pressure will be monitored throughout the procedure. And then EKG. It is we have to do a 12 lead EKG prior to the stress test, and continuous EKG monitoring will be there throughout the procedure. And post procedure 12 lead EKG should be taken to compare the previous EKG with the post procedure EKG to detect any ischemic changes. And level of tiredness of the patient, that should be monitored throughout the procedure in order to assess whether the patient can complete the procedure or not. Now let's see how the procedure is being done. The patient is asked to walk on a treadmill and slowly increase the speed and inclination of the treadmill and monitor all the above mentioned parameters during the procedure. Like as I mentioned, heart rate, respiratory rate, blood pressure, EKG, and level of tiredness of the patient. If the patient feels any discomfort, they can stop the test. And if the patient is able to finish the test, and then cardiologist will evaluate all the vital signs and EKG. Patients are required to not to eat or drink or smoke 4 hours prior to the test, and they should discuss about all the medications that they are taking with the physician. Do not stop taking any medications unless advised by the doctor. So it is the responsibility of the physician to get a thorough health history of the patient and go over with all the medications that they are taking, because some of these medications can alter the test result. So it is a discrete decision of the physician whether the patient should stop certain medications prior to the test. Now let's see what are the medications which can alter the test results. Beta blockers, calcium channel blockers, antiarrhythmic medications, digoxin, and nitrates. So of all among all these medications except nitrates can alter the heart rate. So as I mentioned earlier, there is a target heart rate need to be achieved during the procedure. So if the patients are on these medications, we won't be able to achieve that target heart rate. So it is the decision of the physician whether to stop this medication if the patient is able to tolerate. And nitrates can reduce the ischemic response to exercise in patients with coronary artery disease. So now let's see the reliability of the test. Exercise stress testing is one of the most widely used diagnostic tools to detect myocardial ischemia. According to a study conducted by Purcher and colleagues, the diagnostic accuracy of myocardial ischemia using stress test was high. A sample size of 1,558 patients were included in the study. Ischemia induced by exercise was identified in 481 patients. The ST deviation was highest at 80 milliseconds after the J point. J point is the point where QRS convert to ST segment. and at 2 minutes into recovery. So this shows, we can rely on this stress test to detect myocardial ischemia. And a comparison with another measure, another diagnostic tool. According to another study conducted by Rusto and colleague, myocardial perfusion imaging was superior to ST segment changes in stress test compared with the coronary angiography. In this study, they did one group of patients underwent myocardial perfusion imaging and the other group undergo regular stress test. And both groups were followed up with the coronary angiography. The study concluded with the claim that myocardial perfusion imaging could be more valuable compared to stress test in the management of patients with coronary artery diseases. I came across with some other studies related to stress testing, so I would like to share those with you guys. Me too et al. Conducted a retrospective study to investigate the effects of cardiovascular risk factors on the results of exercise stress test. This study was conducted in 2014. They included 294 patients who had undergone exercise stress test. All these patients were examined for the presence of chest pain related to typical angina, prior history of angina or heart attack, EKG at rest, ejection fraction at echocardiogram, and other cardiovascular risk factors. The investigators did comparison of positive and negative results. The study concluded that history of angina, CAD, hypertension, and lower ejection fraction were powerful predictors of positive exercise stress test results. Another one, as there is growth in cardiac stress testing, Ladpo and his colleagues conducted a study to determine the trends of use of stress test in US is affected by shift of population by demographics, associated risk factors, individual physician choice, or there is any disparity exist among racial and ethnic groups. This study was also conducted in 2014. They found that the upward trend in cardiac stress testing is due to population and individual physician characteristics. The physician decision making on stress testing did not attribute to racial or ethnic disparity. Thank you, everyone. This is the end of my presentation, and these are my references which I have used for this presentation. Thank you, everyone.